Let's talk about some other cancers. I did not realize that proton beam therapy could work for other types of cancer, and there's a lot of different ones. So let's talk about breast. Is it effective for breast cancer, and is there any difference?
So it's important to say that any type of cancer that can be treated with regular radiation can also be treated with proton therapy. The only limitations we have are for very small tumors that move. So something that's right next to the muscle that helps us breathe, the diaphragm, those are a little bit trickier to treat with proton therapy, but we still have ways of doing it. So for breast cancer, we do have to treat the area that's on the chest wall. And what really helps with proton therapy is we're giving less dose to the heart.
And you had mentioned earlier, why is the heart so special when you're doing radiation therapy?
So radiation, one of the potential side effects down the road can be that blood vessels can become more narrow. The important blood vessel in the front part of the heart, the left anterior descending, or LAD, feeds the left ventricle, and that is the main pump that sends blood around our bodies. So that blood vessel is right in the path of a normal radiation beam. With proton therapy, we can bend the beam around the chest wall and avoid that vessel.
And you did that with magnets by guiding the beam?
That's one of the ways, but just the nature of the proton, because there's not an exit dose. So we can tell the computer deposit dose at the edge of the chest wall and then not to carry through the lung or through the heart.
So with the breast, do you go from different angles? Do you go straight ahead? How do you determine that?
Yeah, so we partner with our physicists and our dosimetrists, two very important parts of our team, and we come up with the best beam angles in one of the multidisciplinary meetings that I mentioned. But in general, with regular radiation, we'll have angles from the side because we don't want that scatter dose going through the body. With proton therapy, because there's no exit dose, we can actually bring a beam directly at a patient, and we can make sure that it doesn't go past where it needs to.
So other cancers that we can do, there's breast cancer. How about the esophagus? That's going right down the middle of the chest. It's fairly near the heart. Does that present problems, or how do you attack cancer of the esophagus? I didn't know you could do proton beam therapy for that.
Yeah, the conventional way that we treat esophagus cancer with radiation, which is one of the core ways that we treat esophageal cancer, is a beam from the front and a beam from the back with regular radiation. As you can imagine, that goes right through the heart. With proton therapy, we can treat the esophagus and minimize the dose to the heart.
How long would the treatment usually be, depending on the tumor size?
Roughly, it's about 10 minutes per beam. That's a good way to look at it. So maybe 15 to 20 minutes for most plans. But for really complex plans like a brain cancer or maybe a pediatric cancer, those can take a little bit longer.
So we're going to talk about brain cancers in a minute. Now we're breast, we're at the esophagus. How about the lung tumors, lung cancer? Where is the place of proton therapy for that?
So for really small tumors, we think that stereotactic body radiation therapy. Stereotactic body radiation therapy, or very focal radiation, even using a regular radiation machine is probably the best choice if someone's not a surgery candidate. But once you get above about 3 centimeters, which really isn't that large of a tumor, we start to see the benefit of proton therapy.
Can you get rid of the tumors? Do you see increased lifespan of these people? Do you see the cancer, quote, go away because of the proton therapy?
Absolutely. So when you treat these tumors, you can either see them shrink, turn into scar tissue, and sometimes they disappear entirely, which is always gratifying both for the patient and for the physician.
It must be unbelievable for somebody to say, I've got it, and then all of a sudden it seems to have gone away. Brain cancer.
So brain tumors are fairly uncommon, but we do see them here in East Tennessee. The primary brain tumors that we treat with proton therapy would be a glioma, like a GBM. We hear a lot about that because of Senator McCain right now, but also meningiomas, and there's other benign tumors that we treat as well.
And you do it the same basic way. You hone in the radiation where it doesn't have scattered, it doesn't go through the entire brain. You come in on one area and you concentrate the energy there.
There's so many important parts of the brain that are involved in daily function and short-term memory. So it's important to block radiation from those sites so that once someone survives a diagnosis of a brain tumor or another cancer like a head and neck cancer, that they can go on and still live their lives.
I think it's absolutely amazing. What I really like is the multidisciplinary. It's not just one doctor making the decision. It's a group together that says, this is best and this is the way we should approach. Does everybody agree? What angles do we use?